Dr. Peter McCullough is a practicing internist and cardiologist in Dallas, Texas, and he is an expert in pandemic response, specifically the COVID-19 pandemic. Welcome back to the podcast, Doctor.
Well, thanks for having me.
We were talking off camera before, talking about how this COVID-19 pandemic and how the virus itself affected seniors. And you want to talk a little bit about the response and how the response to the pandemic affected seniors.
The focus always should have been on seniors. We've learned actually early on that it was seniors being disproportionately affected with the respiratory condition, being hospitalized and sadly dying. There was a very, very strong age component to the risk determination for death with COVID. And we should have always had our focus on seniors sick at the time, applying early therapeutics and strategies to prevent hospitalization and death, including strategies in nursing homes and senior centers, assisted living, independent living. That is where America's focus should have been and always should have been there. We should have followed the Great Barrington Declaration, published in October of 2020, that said, only focus on the seniors and those at high risk. Don't shut down the country. Don't shut down businesses. No need to lock down. Instead, we saw everything but that. We saw a focus on young people wearing masks and college vaccine mandates and all of these other pandemic response measures. And quickly, people forgot about the seniors. They were the ones dying of COVID.
I just want to let you know that our CEO, Rebecca Weber, signed off on the Great Barrington Declaration. We did that early on. You're absolutely right. I want to talk about the corruption that resulted because of the COVID-19 pandemic, not just in the medical community, because I think the medical community's hands were kind of tied from government intervention, but it was everywhere. And it was bad news, and it really didn't help the situation.
It's almost as if there were seeds of corruption, and the storm of the COVID-19 pandemic just kind of watered those seeds, and corruption sprouted everywhere. We saw evidence of corruption in the courts. We saw complete hyperbolic statements made. I'll never forget when Supreme Court Justice Sotomayor claimed in Supreme Court deliberations that hundreds and hundreds of children were dying of COVID. It was a completely false statement. It was essentially fraudulent. The corruption that grew into American life, we saw it in the courts all the way to the Supreme Court. We saw it through various forms of predatory businesses, actually. Certain businesses were shut down, but those online and others, in a sense, became hyper-dominant. We saw corruption in elections. It's now became, I think people understand this, that elections are not fair, have been corrupt for many years and not fair. And now we've seen wide open corruption in what we call the biopharmaceutical complex. That is the convergence of public health agencies, government agencies, and the pharmaceutical industry. And the examples are gross at this point in time. And here's an example. A former FDA commissioner, who's an important person in the United States, Scott Gottlieb, is on the board of Pfizer, going on CNBC every day, promoting the Pfizer vaccine, actually interfering with Twitter, trying to suppress information on natural immunity, disgraced. The FDA commissioner after him, Stephen Hahn, joins the venture capital firm for Moderna. So our officials are in lockstep with the pharmaceutical companies working for their next job.
The relationships are a little too cozy between these governmental agencies and big pharma.
And there seems to be no barriers. I'll give you one final example that's, I think, really gross. Weber Shandwick, the marketing firm for Pfizer and Moderna, has an installed marketing unit in the vaccine office of the CDC in Atlanta. In the office. In fact, the CDC is paying them for their marketing services. Senator Rand Paul was outraged. He wrote a letter to Walensky and said, you can't have pharmaceutical companies marketing CDC officials in the vaccine office. Right. You can see that things are off the rails.
Bit of a conflict of interest, wouldn't you say?
A massive conflict of interest. Americans are being defrauded now by this biopharmaceutical complex, and they're angry.
Now, we were blasted with this virus in 2020. Here it is. Let's fast forward to 2023. Would you say, even though we're dealing with the after effects of the crisis, but has the initial COVID or has the COVID-19 crisis cleared?
The crisis in terms of what doctors and hospitals were doing. Now, we were busy. but we crested in January of 2021, shortly after I gave my U.S. Senate testimony on the early treatment protocols. Thank goodness, small number of doctors really banded together. About 500 doctors carried the whole nation on early treatment. Early treatment was the only method to reduce the risk of hospitalization, obviously do something before the hospital, and then also even those who got early treatment benefited from lower in-hospital mortality. But early treatment was the central focus of what America should have done. Keep people out of the hospital, keep them from dying. The emergency largely was through. The tight period was January 2021. We could have closed the emergency at that time, let doctors manage it from that point. We went 2 more years, and now the emergencies are undergoing scheduled closures. This is quite interesting. A lot of Americans didn't know this, but in August of last year, we also declared a monkeypox emergency. Now, I don't think any of your, members of your organization ever felt a monkeypox emergency. I saw one case in my practice. I can tell you that January 31st, without any fanfare or press release, the monkeypox emergency was retired. Now, a few days ago in California, Governor Gavin Newsom let the medical emergency for COVID retire without much fanfare. We're down to, I think, 6 or 7 states that still have statewide emergencies declared. Texas is one of them where I live. It needs to be closed. President Biden has said that in May of 2023 that he's just going to let the COVID emergency expire. So there's actually no declaration of victory. There's no closure. There's just kind of quietly things are simply not renewed. The emergency ends because something is not renewed. Of interest, though, the PrEP Act, which provides broad liability protections and all of this, that is not scheduled to close until the fall of 2024.
2024?
Right.
Okay. That's interesting. I'd really love to know your opinion, Doctor, on the Department of Energy's recent disclosure about the origin of COVID-19.
Wasn't that a disclosure? In 2 ways. It wasn't just the Department of Energy, but Christopher Wray came out and said the FBI also determined
yes.
that the virus came out of the lab. Well, this is what we know. Menicheri and colleagues in 2015 published in Nature Communications and Proceedings of the National Academy of Sciences, 2 well-read journals in my field. Mm-hmm. So it was known in 2015. They said they created SARS-CoV-2. They created it. It was U.S. engineering, U.S. NIH grants. The work was done in the Wuhan lab of China because they couldn't do gain-of-function research in the United States. This was all done in 2015. It says we created it. We got it to jump from a bat into a human and invade a human respiratory epithelium in an animal. We accomplished it. They accomplished developing something, made it more infectious and more virulent and able to actually invade a human body. Normally, coronaviruses don't do that. That was in 2015, done in the Wuhan lab. They thanked the Wuhan lab. The second paper, they named some of the workers there, including Dr. Xingling Li, who's the bat lady, in the paper. So it's all there. 100% it was created in lab in 2015. This is broadly announced to the world. What we saw in 2020 was Anthony Fauci, Francis Collins, the liberal media saying, well, it came out of a fish market. Anybody who said it came out of the lab is spreading misinformation. It turns out the whole fish market idea was an attempted cover-up. Now we learn that, wait a minute, it wasn't just the NIH and BARDA. Department of Energy had some oversight in Wuhan. The FBI had some oversight. Almost certainly DARPA and the other agencies, the intelligence community. Turns out that biological threat development research has broad governmental oversight, multiple different departments, and now they feel obligated to come out. DOE actually says SARS-CoV-2 is one of their projects, so they actually have some oversight here. They feel like they have to come out and come clean on this because they know there's a day of reckoning.
It is a day of reckoning, and thank you for that perspective. I appreciate it.
Yeah.
If people want to follow your work, you make a lot of media appearances. You're a busy guy practicing medicine. How can they do that?
I've just signed a contract, and we're going to launch a new show in Dallas on AFN Network, a brand new network with John Leake. It's called The Second Opinion. You can see the billboards here at CPAC. This is going to be a wide-ranging program of which we'd love to have you on and learn about your organization, covering civil liberties in the context of these medical biopharmaceutical complex issues that have come forward. You can go to my website, Peter McCullough, MD. That'll take you everywhere. My current podcast is America Out Loud Talk Radio, McCullough Report. Substack is Courageous Discourse. And then my book, Courage to Face COVID-19. Go to couragetofacecovid.com.
How's the book doing?
The book has got over 1,000 five-star ratings on Amazon, #1 rated in multiple categories. It's the only book in this COVID era that's not a boring medical book. It's actually a gripping thriller about what happens. Part of it takes place in Dallas, where I was, how the White House reached out to me, then the Senate, what was going on in France, historical context. How did I set all the records on Joe Rogan? Eclipsing Elon Musk. You're looking at him. I'm the record holder. It's all in the book. You can read it in a couple hours. The audiobook, I think, is free or minimal cost with one of the readers. Get couragetofacecovid.com.
Dr. McCullough, thank you so much for taking the time to visit us.
Thank you.